have a struggling learner, how do you balance some of that with really trying to protect patients, protect yourself, obviously, and your license, giving that critical feedback. So how do you maintain a respectful and professional tone with the learner when they seem disengaged, defensive, or difficult?
I still think there's a level of respect because, again, you don't know what each person's experiencing in their life, and still your primary goal is to care for your patient. And fortunately, I haven't had a situation where I've had someone I felt was dangerous. Now, I have had people who have been distant, and I try to meet them where they are and pull them into my space. And sometimes they just don't want to come. They don't want to be there, and that's okay. But at least engage and still try to meet them where they're, understand what they're going through. What is there a deficit? What could we do this differently? Could you suggest a different way that we round? What do you think? And I bounce it back to them. And I really legitimately do. Is there any different way that I can teach you? Do you need a keynote presentation? What works for you? And just have them express what works for them. And that shows respect for them and maybe will help to entice them to come out of their shell a little bit more, to trust you. But these are conversations that have to be had, and it is our responsibility to figure out how to extend that olive branch to reach that person.
Mm-hmm.
Yeah, I mean, a lot of times when I do have learners who are struggling in terms of learning certain concepts or techniques, I do let them know, hey, listen, I'm going to give you feedback and I'm going to give you advice, but this is because I know you can do it. And I really try to instill in them, like, you've climbed all these mountains and
right.
climbed all these milestones, and you didn't get here by accident.
Exactly.
You've done a lot of work to get here. So I try to instill that feeling of belonging in them, like, you can do this. And I didn't know this when I was at your level either. And I try to share that as well, my vulnerabilities and what I didn't know. And that it's really about connection with that resident, especially if they're struggling, about listening to learn what's going on and trying to understand where they're at and what's going on, and how to engage them to get to the levels where they need to be. And I also ask, like, what can I do better as an attending? How can I teach you better? What makes you learn better? And it's about them learning their own teaching style as well, so that they can be self-aware to have their own growth as well. So I think it's important too.
I think what you said was key. They did not get here by accident.
Yeah,
they worked hard.
Yes,
and they got here off of their merit. So if there's what we perceive as a failure, then we need to reach out and say, how can I make this better for you?
And we failed.
They deserve to be here as much as we do.
Yes, absolutely. And we're a team. It's a teamwork, right? And that's what it is. It's not really about just the hierarchy of things. It's about treating everyone as a human.
Exactly.
And we're all learners together. Even as attendings, I'm still learning things. So, and we have to be open to that as well. So I think engaging them is so important, and also just trying to encourage them and change that environment of criticism and harshness, and really just be more encouraging, not to be soft, but, to hold high standards, but also high accountability at the same time.
So I like to compare residency to Montessori school. So the residents will hear me compare their learning 3-year, in our case, years longer, arch to the Montessori 3-year arch. And so I say, my kid goes to Montessori school, and she's a really strong reader. Maybe she's a little lower in math and spelling. But the important part is the competencies. And Montessorians get it, that it's an arc, and that you're not all going to hit it at the same pace. And so it's okay if you're better over here and you haven't caught on to this yet. So we work in that yet. You will get there, and let's give you some more resources, give you some more time. Is it insulin? Let me go through it with you real quick. Let's set you up with the PharmD for an extra lecture, or let me share resources. So I think just reminding them that this is not school. This is patient care, and the competencies matter most. It's not a check mark or I did the time. It's a what did I learn while I was here in order to reach the end of that rainbow arc where, okay, we can set you off into the world and you have to continue to learn for the rest of your career. Please don't peak at the end of residency.
Yeah, our patients need more from us than that.
Yes.
For sure. And when you were talking, Dr. George, I was thinking about Brene Brown with the strong back, soft front. So that's kind of always strong back, have your principles, help hold them accountable, but do it with the lightest touch, taking into consideration that there's a human on the other side of that feedback. That, and I think sometimes, things land well and things don't land well. So, have you all ever had a time where you thought you were giving some really helpful feedback to a learner and it didn't land so good?
Oh, yeah. Of course. Yeah.
I gave somebody some feedback last year and found out that at the end of the day, she'd run to a co-resident crying, saying that Dr. Bailey thinks I'm an idiot because I didn't know XYZ. And so I had to go back in there and pull her aside and say, no, that is not what I think of you at all. I think you're very talented. I think you have room for growth. Otherwise, I wouldn't be in here teaching you. To the contrary.
I think those moments are good for us always to remember, like, we were there too, right?
Oh, yeah, and it made me look back on what did I say exactly that didn't land or that made them think that was my impression. How could I do that better?
And I've done that. I mean, I'm in the operating room. There's tension. There's a lot going on, and I've tried to debrief after any situation to make certain everyone has an opportunity to make a comment, and then also the residents. And I full circle want them to know that my goal every day is to safely take care of a human who's trusting me to take care of them. And that if I stepped on your toes along the way, I sincerely apologize, but you have to understand that Betty, this patient, is my focus today. But we still have to come back around and say, let's talk about this. Let's talk about this aortic rupture and why I was a little bit quick on my draw. You have to explain. And I think when you put it to the students and residents that our goal is for human care, someone is trusting us. And oftentimes you have to kind of get over ourselves, come to the table and say, this was the goal. And could we do it better? How can I do it better? And then really work on that. But have them be part of the conversation. How can we have done this better? Go. What do you think? What do you think? What do you think? Because that really is important with so much diversity nowadays, which is phenomenal. That's how we are so successful, because there's so much diversity at the table, learning differences, different perspective, different cultural perspectives. We really, as the leader, and I'm the leader in the OR, there's no one else above me. I have to stop and say, how can we do this different? Let's hear from everybody. And they're part of that. Let them have that voice.
Absolutely. And I just piggyback on that, just self-awareness, creating that self-awareness in the learners. And so that we're not just always constantly telling them, you did this, you did this. They should be able to realize for themselves, like, oh, wait, I should have done that better. So I think debriefing is so key. Like, what did you do better? Like, what did you do okay? What are you proud of? And what do you think there's room to grow in? And so I think debriefing is important, and creating that self-awareness in the learner is absolutely more important.
And that's something I think we didn't have as residents. I don't remember. I mean, I don't think the word debrief existed when I was in training. So I've had to learn that as an attending and a teacher, for sure. And it's different. And I love the residents, because sometimes my chief will remind me, hey, didn't go. Maybe you want to doing a little debriefing. I'm like, oh yeah, that thing. I thought we talked about it, but sure, we can do more formal.
Absolutely. And I still remember my first intubation as a medical student. And I remember everyone looking at me and I didn't get it. And my senior had to step in, but the attending pulled me aside and he went through it with me and said, but I know you can do this. And I still remember that. That was 15 years, 20 years ago. And I still remember that, like, I know you can do this. And so I think that's important too, as well, to just encourage them, but also to give that feedback into constructive criticism, to know where they can improve, but also to know I'm doing this for your best interest.
Right.
Wow, I think we could do a whole session on just debriefing, because I think it sounds like we have a lot of experience with that, and it seems to be a core behavior or core element of keeping a safe learning environment, keeping it all professional, keeping it about the patient, or alternatively keeping it about the learner and the growth that's taking place, and not getting lost in the details or the emotion of the moment.
And I think we also have to make certain that they see us and practicing this, having the nurses tell us, having my OR staff, my first assistants, these students are watching us. And if you say do X, Y, and Z, and then you walk around the floor like you're the queen, you have to actually see them asking your first assistant, hey, Kristen, what do you think I could have done differently? What do you think? And then having everyone in the room weigh in. They have to see us actively doing this.
Absolutely. It helps promote our own self-awareness, and show our openness to feedback.
Exactly.
And it's a tangible way they can see us.
This is a team
living
sport.
on our values.
Absolutely.
Right.
It's a team sport.
Right. Well, great. I've had a lot of fun talking to you guys and gleaning so much from your experiences as educators. Now, we'd like to see what kind of advice you might have for those who are needing a little development in this area of boundaries, giving feedback, creating a respectful environment for learners. So what's one thing you could tell maybe a new faculty member to start doing tomorrow to help us together create a more supportive environment?
I think the number one thing that faculty should stop saying is back in my day.
Oh, gosh.
Or when I was a resident.
Everybody stops saying that.
Yeah. One, that's making me like home. Two, we didn't do it right back then. Right. And we know this.
Yeah.
Right.
There's data surrounding that it wasn't healthy for patient care,
For us.
for residents, for attendings. And so, yes, that's the way we did it for a very long time.
That's not how we're going to do it.
That wasn't the best way to do it, and we're still learning how to do it. So just one, if you feel that sentence coming out of your mouth, stop. Just stop there and rephrase it and think about it differently and think about how could we do it different from back in my day? What might that look like?
I think it's intentionally creating our future.
I completely agree with that. And that was what I was going to say. That person standing in front of you, again, didn't get here by accident. They were chosen to do this just as much as I was. And think back to when you were in that position and be respectful. And this is the person who's going to take care of me, right? Period. So we have to stop and have respect for this student and really cultivate them to take care of me. Because we did not do a good job back in the day, and we did not have diversity, and we did not have people who looked like us. And we are better for this. So stop, listen, be respectful, and really cultivate that next generation of doctors.
Yeah.
Exactly. To collaborate, cultivate, all the C words, I guess, to stay calm.
That's a given.
But also, I think for me, as I'm getting more experience, is to stay curious, as an attending, and don't think that you have all the answers, and to be open to learning, to looking up, to using AI. We use open evidence in the ER department, and so we get the journals, and we can go back and read it at home, but we get those snippets of information, and I'm reading it with them, and I'm explaining it with them, and we're talking and discussing it together. So I think curiosity is really going to be helpful in terms of creating a collaborative environment of growth and learning.
I think there's always room for each of us to grow. I think having eyes to see are important, like entering into the work environment, seeing what's going well, what's not going well. I was wondering if we could give a shout out as we close to a resident or two that has done something, you've noticed something about that person that has contributed to our positive culture here. Anybody have any shout outs they want to give as we wrap up?
I've got a bunch of residents.
You got a lot.
I know. I can't narrow it down. I'm so proud of them.
Gosh, there's so many.
I really, my lady residents for sure, their courage, that this new generation of women are speaking up for themselves, and I'm so proud of them. And they're so good, and their male colleagues are supporting them and speaking up. I think this is a fascinating world that we're traveling into, and I love it. I love that each one of us are lifting each other up, that we're respectful for one another. That was not the case back in my day.
You can use it then. That's appropriate, I think.
So I'm very proud of all of our general surgery residents. They're strong, they're smart, they're charismatic, they're curious, they're kind, and I can't pull out just one because it would be a disgrace not to pull them all into it. So it's not just one. I'm very proud of all of them.
That's awesome.
Yeah. And I would echo that. I mean, I'm so proud of, especially our lady residents. They've, we have a lot of moms, and we have a lot of moms who are juggling home life with kids.
Dads who are juggling home life.
Exactly, with mom and dads in our area residency. And we have people who are away from home as well. So it's a lot of stress on that as well. We're coming into a stressful environment, but it's stressful to come home and sometimes be dealing with stress at home, and so they're juggling a lot, and I'm so proud of them in terms of just maintaining their wellness and coming in and being able to work and really be a team player. So I absolutely think we have a great class, and I'm just so proud of my ER residents.
Same for the family medicine residents. I could name so many of them. We have 12 in each year, and I love watching their growth. I like watching them jump in to teach their patients, to teach the students, to teach me. I just really love watching them from day one. And then I cry every graduation because we're launching 12 more great physicians into the world that I would trust to take care of my family. So I'm very proud of them. And for them daring to be so brave.
I get a little tearful too for my surgeons, because I'm like, oh my God, you're a surgeon. Like, they're a surgeon and they're doing great work. And I just I remember a few years ago, but I'm just so proud of them, and they are just so high quality.
Well, they're our torchbearers of our culture. I feel like we set the stage. They're the performers in that, and they're sharing that culture with the community that we serve, and kind of trying to, as leaders and as faculty, be mindful to tend the culture, right? Because we see things that aren't consistent with our culture, and having that bravery to call it what it is and pivot back to what we know are our core values and the culture that we want to train residents in. So I'm grateful for your time today, talking a little bit about the culture and how important it is to the training here at Northeast Georgia. We hope that this will inspire faculty to take some of these tidbits, listening, seek to understand, debrief, share positive intent, always have the most positive interpretation of the events that you're seeing, give grace, room for movement, have strong back, soft front, hold the line, toe the line in accountability, but also being generous to the resident, recognizing that they're whole people.
Yeah.
So I'm very proud to call y'all colleagues and grateful for our time that we had today.
Thank you for doing this.
Thanks for having me.
Yeah, thank you.
Great to be here. Thank you. It's a pleasure.